Good day. We're still busy with Mother Baby Friendly Initiative. I'm still Anna Nolte. We're busy with session 4 regarding the newborn problems and expression of breast milk. And we're now at lesson 3, feeding bottles, teats and pacifiers. Now, feeding bottles, teats and pacifiers is one of the steps of the 10 steps to successful breastfeeding, which we will come to in more detail now. And it's a very controversial topic because if you really Google, for example, the use of pacifiers, you will see there's quite a lot of research has been done on whether and how it influences breastfeeding. And you will see there are a lot of different opinions on pacifiers. I'm going to focus my lesson to a very large extent on the Mother Baby Friendly Initiative and what they say about pacifiers and bottle teats and etc. There's also an article, a very good article on the use of pacifiers that I will highlight a little bit later, and that we will also load on the website for you. And if you have time, please read it. It's a very good article, but I will talk about it a little bit later in more detail. Okay, so I've said we are still part of Mother Baby Friendly Initiative, and this is step 9 of the 10 steps to successful breastfeeding. And this says that hospitals should support mothers to breastfeed by counsel mothers on the use and the risk of feeding bottles, teats, and pacifiers. So with the main aim on counsel, not force or not tell them to, but to counsel them. And when one counsels somebody on something, you obviously tell them about the advantages and disadvantages of what is good and what is not good. So if you look at the the rationale again and all the different implementation standards, I usually go through these with you in detail. I'm not really going to go into much detail about it. You can read through it, but specifically if we look at the implementation standards, there are different implementation standards, as you will see and as you read through this, for preterm babies and for term babies, and I will do that separately regarding the preterm and the term babies. So we'll come to that a little bit later on. Now, this is the article that I have referred to. It's when is the use of pacifiers justifiable in the Baby Friendly Hospital Initiative, a clinician's guide, and we will post this article for you. It is a very good article. It refers to the use of pacifiers to a large extent in the case of preterm babies, but also term babies. And as you can see, it's in the context of the Baby Friendly Hospital, and it's a fairly new article. It's a 2017 article, so I would really recommend that you read the article. Okay, so I've said I will talk about the steps, the implementation standards, a little bit separately. And here we talk about specifically the non-nutritive sucking and oral stimulation that should be encouraged and taught to mothers of preterm infants who are unable to breastfeed directly until the breastfeeding is established. Now, there are different ways that non-nutritive sucking can be and oral stimulation can be stimulated. The one is to use a gloved finger or a breast that's not yet producing milk, and even if it does produce milk, the non-nutritive, the baby can be put to the breast, and the baby's just sucking a little bit, and the specific sucking is non-nutritive sucking. Remember, we have talked about non-nutritive sucking now a few times. Non-nutritive sucking refers to the fast sucking that the baby usually sucks in the beginning, suckling in the beginning of breastfeeding, when the milk is not, the letdown reflex hasn't started, and it means he doesn't get any food from the sucking. And the same then when the baby is sucking on a pacifier, it will obviously be non-nutritive sucking. So a gloved finger or a breast that's not yet producing milk or expressed milk can be used to just make the baby to suck without getting any milk. And then if a pacifier is being used, and it is recommended, and you will see in the article that it's really recommended that preterm babies do get pacifiers to stimulate the non-nutritive sucking, and we will talk a little bit about it as well. So when a pacifier is used, the correct pacifier should be used. So a lactation consultant or a trained healthcare professional should be able to counsel or advise the mother on the correct use and the correct pacifier to use. And pacifiers should only be used when the infant is awake or drowsy and for the purpose of stimulate the development of sucking behavior. It shouldn't be used all the time when the baby is sleeping and when the baby is not sleeping, because this has definite advantages which we will come again to in more detail. It improves the sucking behavior, it improves digestion, and it supports calming and a relief of stress, anxiety, and pain. And as I'm saying, we will come to in more detail to all these advantages. Now, like I've said, blanket use, overuse all the time of pacifiers is not recommended unless justified for some or other medical reasons. But pacifiers should be used when the infant is awake or drowsy to do the necessary non-nutritive stimulation. Now, together with the non-nutritive sucking and the use of pacifiers, very important then also under the preterm babies is that if expressed breast milk or other feeds are medically indicated for preterm infants, feeding methods such as a cup or a spoon should be used instead of bottles until the infant shows mature feeding readiness, and then he can start sucking on the breast itself. And then when we further look at the non-nutritive sucking pattern in infants, as we've said, there are definite advantages. And one of these advantages is to increase peristalsis. So it helps with the digestion of the milk. It enhances secretion of digestive fluids, which further helps with that. And it decreases crying in these infants. And these infants now are the premature infants. Now, the kangaroo mother care and non-nutritive sucking at the breast are also very important developmentally ways of providing non-nutritive sucking. The baby can suck on the breast. Emptying the breast is usually not necessary because the baby don't really get milk out of the breast when he sucks non-nutritive. So the baby can be put to the breast anytime, and then and you will see, you've seen that on the video of the preterm babies, how the baby just lick and suck a little bit, and that eventually, I always say that they are practicing to breastfeed eventually. And if they just swallow small doses of boluses of breast milk, and specifically in the case of colostrum, it helps them just to eventually get the right milk, and then eventually they will be able, as I'm saying, they practice to do proper breastfeeding. Now, if we look at the step 9 at the steps, the implementation standards specifically for term babies, then the pregnant woman and mother should be informed on the following reasons why dummies are not recommended, and specifically in the early weeks of pregnancy, early weeks of breastfeeding, and we will come to this early weeks again. The reason why it's not recommended, it's because there are different types of suck, so that there's a potential for suck confusion. And then also, very important, it's harder for the mother to recognize feeding cues because she usually gives the dummy to the baby. And remember, the feeding cues are the baby makes sucking noises or sucking movements and he sucks his fingers, etc. And that will then not be recognized by the mother, and we will come to this again a little bit later, what effect it has on breastfeeding. And then very important, babies who are sucking their pacifiers tend to feed less often, and we will also come to that again. And it also might reduce the time that the baby sucks on a breast. And eventually the fact that they feed less often, together with the fact that they are shorter on the breast, might obviously decrease the milk supply. Now, the reason why we are saying that that pacifiers should preferably not be used the first 3 to 4 weeks until breastfeeding is well established is because of these reasons that I've mentioned here. And as we've said so many times, it's important that the baby in the first few weeks of his life and of breastfeeding should feed more frequently on demand, so that the mother should be able to recognize the signs, and she wouldn't be able if the baby is using a pacifier. But as soon as breastfeeding is established, the baby can still suck the pacifier, because then all these things are being established and it's not so important anymore. If we just look at in general at sucking in term babies. Now, sucking is a basic instinct, and babies are being born with a so-called suck reflex. So, and baby sucks for two reasons: for food and for comfort. And breastfeeding offers a lot of security as well, together with the comfort. So, um, breastfeeding basically provides all three of these things. So, if whether the baby is feeling lonely, frightened, sad, cross, or ill, it is with the new situation, and the baby gets all the comfort that he gets from the breast. Now, what is very important, coming back to the pacifiers, is that mothers, and we have talked about that in our first and second session as well, that the mothers might often feel overwhelmed by the baby's needs to nurse in the early days. He needs to nurse frequently, and we've said anything from 8 to 12 times a day the baby needs to be fed, and mothers might just feel they do nothing else but feeding the baby. So it makes them also make them to kind of give them a pacifier to just have a little bit of freedom and a little bit of being released from this overwhelmness about the breastfeeding. But then also, on the other hand, if she meets his needs, and if there's enough milk, and if she makes him feel safe and she has plenty of milk, obviously that's where confidence is coming in. And that, on the other hand, has a very positive on breastfeeding, as we've said previously. Now, when there's a substitute for sucking, now whether it's now a pacifier or giving a supplement by a bottle, there's obviously, one can see in this that there's a very close bond forming, especially when the mother comes here, when she feels that she makes her baby feel safe and she gives him enough milk. Then a substitute might interfere with this breastfeeding relationship, especially, as we're saying here, for a baby who has not yet mastered the nursing at the breast yet. So that's why we're saying pacifiers should not be given the first 3 to 4 weeks of life. Now, what does pacifiers do? The very important thing is, when pacifiers are being given before 4 weeks of age and used most days, it's significantly associated with shorter duration of breastfeeding in general. Mothers stop breastfeeding sooner. And the reason for that is, yes, um, pacifiers are being used to soothe the baby and to put the baby to sleep, and it makes the baby quiet. So that's the reason why a pacifier is being used. But that then, while it helps the mother, at the same time, it postpones or stretches out the time between breastfeedings. Now, as we've said, when mothers feel overwhelmed, this is a good thing for them, to help them a little bit to feel less overwhelmed. But on the other hand, then they have to sacrifice the advantages of more frequent feedings, because research has also shown that when a pacifier is being used, one fewer breastfeeding per 24 hours have been given. So, and that is very important, because as we've said many times, that milk production is directly linked to frequent effective feeds, because this is how the breast is being emptied and what stimulates the breast to make more milk. So the moment that the baby is less time on the breast and suction less frequently, obviously that will make the fact that there's not enough milk being produced, and that eventually makes that less mothers are exclusive breastfeeding when they are giving pacifiers. And also because it delays feeding past the hunger cues. That's now a pacifier that delays feeding past the hunger cues, makes that the baby then wakes up and is very hungry, is overly hungry and is cross and he cries. And we have said that that's often very difficult to get a baby who is very hungry and who's very angry to settle down so that he can suck effectively on the breast. And that's also one of the reasons why mother's exclusive breastfeeding then doesn't work. Now, when we come to bottle teats, very similar but also different. Although it's possible that some infants are confused by the different teats and the different ways that they are sucking, one can also talk about bottle feeding and bottle feeders as having a preference for certain um, teats or nipples. For example, infants who do not know how to breastfeed, this is now in the beginning of breastfeeding, they struggle to breastfeed because of not latching properly, not positioned properly. They cannot transfer the milk from the breast, etc. These babies often get anxious and they're crying and they are unhappy babies and because they are hungry. And they would then prefer a bottle teat instead of being confused by a bottle teat, because it's just so much easier for them to suck on the bottle teat. But then this can then easily lead to negative breastfeeding experience and then breast aversion because it's so much easier to bottle feed. Now, we have talked a lot about the differences between sucking and suckling when we did in our previous session, when we talked about latching and not latching, and the fact that the baby sucks the nipple in the case of breastfeeding into his mouth with a negative pressure, and the only thing that he sucks is to suck the nipple into the mouth. And the suckling action is basically the movement of his jaws, that he gets the milk out of the breast by pressing that with his jaws, upper jaw and lower jaw on these ducts that comes into from the glands into the nipple. And then he moves the milk backwards, peristaltic movements with his tongue so that the milk that he swallows the milk. While with the bottle, the teats sits differently in the mouth of the baby. Look where the tongue is. And also the lips are much more thin. While the lips are soft here and loose, it's much more firm here. And the baby gets the milk out of the bottle with a negative pressure by sucking it. So the question is that nipple preference or nipple confusion when the baby is getting milk, supplementary feeds in a bottle. So and that's the one reason why we've done in the previous lesson why it's much better to cup feed a baby when he needs supplementary food. And that brings us then to the end of lesson 3. Complete your quiz so that you can carry on with the next lesson.